So let me introduce them a little bit to you, and then they'll also tell you a little bit more about themselves. But when I say that there is no disaster or humanitarian crisis in the world that Eliash has not responded to, I would not be exaggerating. He has a decades-long career in providing medical and humanitarian aid around the world with multiple organizations, Partners in Health, Doctors Without Borders, MSF, and other NGOs and governments. And came to our master's program almost mid-career, finishing in 2017. And he'll talk to us this evening about how his bioethics training has really impacted the work that he's been doing, around the globe. And our second panelist who's joined us so far is Dr. H.S. Tan, Wisu Tan, a pediatrician from Malaysia, who came to the program in the fall of 2018 with a little idea that maybe it would be a good idea to start a clinical ethics committee at her hospital in Malaysia, and has now grown into a countrywide leader in clinical ethics, as well as taking on larger leadership roles across Southeast Asia in setting standards for clinical ethics and bringing clinical ethics into practice. And really had the honor of spending some time with her at the Academy of Medicine in Malaysia, and doing some clinical ethics capacity building there this past summer with a group of our alums. So welcome. And then let me just tell you a little bit about Gloria Mason-Ross, in hopes that she will join us. But if she doesn't make it this evening, we'll make sure to have an opportunity for you to catch her in the future. She's a student who came to us also in the fall of 2016 in Eliash's class, having just completed a fellowship at the National Institutes of Health in Research Ethics, sponsored by the government of Liberia. And she came as a young research ethics professional, hoping to build a career in research ethics, and now oversees the research board in Liberia, and has been a leading voice in West Africa, especially around standards for clinical research and clinical research in Liberia and beyond. So welcome to our panelists. It's so wonderful to see both of you, and so amazing to see all the things that you've accomplished since the time that you've been in the master's program. So it's really a wonderful opportunity for prospective members of our community to hear from both of you about your paths. So let me, Eliash, give it to you first. And I've said a little bit about all the amazing things you've done, but maybe you'd like to introduce yourself and say a little bit about what you're up to and what led you to study bioethics in the first place all these years ago.
Thank you, Rebecca. Thank you, everybody, for this invitation. My name is Elias Pavlopoulos, and I worked the last 20 years in different places around the world, around 20 countries, mostly epidemics and conflict and post-conflict situations. I will say that it's quite easy for me to say why I follow after my training in public health in London, after I continue in Harvard Medical School with bioethics. In humanitarian arena, we always face moral dilemmas. And I can say that the motivation behind coming in Boston and taking this master had to do first that the most heated debates that I had inside MSF, inside Doctors Without Borders that I was working in this period, I can say that was about moral issues. I have seen people fighting like there is no tomorrow, okay? So in defending issues related with isolation and of drug resistance tuberculosis patients and things like that. In the other side, us having leadership positions, mainly all these years, I will say that for me it's very important that to have a better understanding of the different ethical issues that arrive in humanitarian medicine. And also I can say that before I do my training, I can say that the main thing that I realize when arrive moral issues on the table is that it's not that the people become immoral or the people they take one stance or another, etc. That the people didn't discuss the issues that have to do with ethical dilemmas or other ethical issues. They just hide them, and I feel completely annoyed. Okay, so to have to deal with situations that the people they try to escape from that because simply they couldn't find a way forward. And this, I can say, helped me a lot, the master in bioethics, together with improving my ethical reasoning. Okay, so, and I will say that in the area of global health and all the moral issues that we have is very important, this part position me better. I have a better positioning to address different moral dilemmas. We have a lot of, and we'll speak later about it. Okay, so but my positioning is much better after this master, and of course for me was important because my background was public health. Okay, so to have more analytical philosophical training. So let's say to understand moral theories, to connect the things between moral theories and practice. Okay, so and how we react and how we take decisions. Okay, so more ethical decisions. Okay, so to avoid the no decision trap, I would say.
Wow. Okay. So there's a lot there. So let me just recap some of the things because you said it better than we could say it when we just give our usual slide deck about what the goals of the program are and what our students get from the program. But really, the ability that you were sitting with a lot of moral distress in your work. There are ethical issues that came up all the time about people we can treat. Where do we put our resources? How do we keep people safe amidst conflict? How do we make resource allocation decisions when there's no way to provide all the relief everyone needs, and that you were feeling a sense of moral distress or an intuition that there were things that needed to be made explicit or talk about, and that through the program you really developed the capacity to identify the issues, think about them through a number of different lenses, and be able to give the kinds of reasons that questions of such global impact require, and to, as a leader, to empower your team to be having those conversations and setting policy as well. Fantastic. So, HS, why don't you tell us a little bit about what about yourself and what brought you to the program many years ago now, 7 years ago now?
Yeah. Thank you so much. And it's actually great to be back to this introduction to the program. And I'm happy to actually share how it came about, that it was kind of same thing with Elias about like the mid-career reason that we took a break, a gap, kind of a gap year. But for real reasons that it was much more of a struggle that we had during our years of managing patients and also managing, basically running departments. And I think that was where you kind of feel how tough it is to actually bring what is best to some of our patients, because I think there were struggles with resources. One thing, I was actually kind of practicing in the district side of Malaysia, and we had much of issues with the patients coming in with many social issues. And I think that was where I can't put a name to it, how they actually came and not able to actually follow through all your follow-ups and your treatment. And you felt that you were one of the best doctors around and you have all you get, all you have in terms of providing care. But, there are issues that they were not able to comply and not able to actually agreeing to some of the treatment, and that is where you start thinking about, much more factors that comes into play when it comes to decision making, when it comes to medicine itself, So there are many, many social, political determinants that comes when it comes to patients' care. That is one thing, and the second thing is much more of how the medical legal fear, or what we call the legal risk, that was very much a challenge in Malaysian practice, as I think many were fearful about the steps that they're going to take, the problems they're going to take the problems they're going to get into when, when they don't follow certain ways of managing, that they will get trouble in the courts and, not able to get themselves out. And I think that there are issues where, the way that we are practicing has turned into kind of quite a bit of a defensive medicine. So we kind of forget about, like, trying to just do what we can with the families and the patients and just going back to what matters to them the most, and what they actually prefer, and what values that they hold, that kind of we get very much distracted with that part. So I think it was maybe 15 years after being a specialist, that was where, I think maybe it's time to just go back to school and think about what is the best way to actually change some of the things on the ground. And we do have, a vibrant research ethics service committees and the community itself, but I think there were not much of a clinical ethics service in the hospital. So it is something that is not heard of. And we never, kind of knew about what it's all about, the moral distress that we were feeling. And I think we were getting quite a bit of burnout because we were not able to actually do the right thing for many reasons, institutional, limitations, systemic issues that we were not having, a venue that we could actually talk about it and, try to kind of resolve it. So that actually draws me to bioethics, because it's not just, the philosophical part of, like, really thinking hard about some of the difficult questions in medicine, looking at things differently and, really finding our way back to humanity, but it's also very much practical because there are many approaches that you can actually apply when it comes to cases, issues, so that is something that draws me to clinical ethics and the ways that, we actually kind of have a systematic framework to actually approach to some of the dilemmas that we have in care. So yeah, so after, that I managed to kind of finish the program, I just brought every skills and knowledge back. And, so at this point of time, we have a bit of a team and a service that we are running for the hospitals and also any other, hospitals beyond that. So I'm very much interested in kind of developing and building the capacities for clinical ethics committees at this point of time in any hospitals across the, public sector, the university, and so the private sector. Yeah.
Wow. So there's a lot there, but again, just a recurring theme for, as somebody else who came mid-career to the program, really feeling like you had a moral intuition, and some moral distress around wanting to deliver the highest quality care, and then seeing some of the social circumstances and determinants of health really getting in the way for some of your patients, while also really perceiving amongst your peers that this defensive medicine kind of stance was really leading to a lot of concerns about making sure you were doing the right thing, not wanting to be, or fear of being held responsible for things beyond one's control or for bad outcomes, and really benefiting from developing a paradigm to think about these questions, to be able to speak about them, to name them, to bring them into the consciousness, not just of yourself and your colleagues, but also the systems that you're working in across the public sector, the universities, and other places. So a lot of common themes there. Let me ask you, when you think about now, the biggest challenges that you've been facing in ethical challenges in pediatric care or in clinical ethics, as you've now been back in Malaysia 6 years, really building these programs, doing huge amounts of education, getting buy-in, driving change. What are the things that you're facing now that you feel particularly well equipped to manage, that you didn't expect, or that you imagine you wouldn't have been able to handle without having come to the degree?
Thanks for the question. Just on back to just pediatrics, because that's where I'm practicing this point. Definitely there are also issues in the adult medicine as well. Just back to pediatrics because it's something that which is very unique when it comes to decision making. And I think we have reached a stage where we could do quite a bit of things, with some of the complex congenital conditions of some of the babies that we have. We can do much with, the smallest babies and babies which are extremely low birth weight, the extreme premature babies. And we have had a few, opportunities to be accessible to some of the novel treatment for rare diseases in Malaysia as well. So I think that's where, we start to think about, as who's going to decide, what is best for that child or that baby. And it's not just, thinking what is best from the professional view. That is one thing that I've learned about, how do you look at, how do we define best interest in some of these children and, babies that do not actually have the autonomy to actually make decisions for themselves. And you have to actually kind of think about when you decide what is best, who decides that and what framework you're going to use and what principles you're going to use. So it becomes a bit clearer, to kind of put them in boxes and every child, every families would probably bring in different stories, and they will probably have different challenges, they have different hope. And I think that's where, we have to actually put all in and to actually consider what's best for that child rather than going by just professional standards or, just discuss among ourselves, in the fraternity. We have to actually question ourselves, why are we doing this? Where are we cutting as in terms of resources, So we have to actually decide what's best for that individual child family. What are their rights, if they are actually coming up and say, this is what we want, and also justice for all. So there's kind of still challenges in terms of trying to find that balance because different region in the country tend to have like kind of different resources, different expertise, and different support systems, and I think it is still kind of I think it's much more something that we kind of be able to actually acknowledge there are issues rather than really finding, the right answers to to every issues that we have. So pediatrics in terms of, that it would be a bit more towards, the smallest babies, and the rare diseases part of care. Yeah.
Yeah, well, that's really there's so much we could talk about in there, right? So part of it is about resources now available for even the smallest of babies that weren't available previously, but also disparities in where that's available, and also thinking beyond just what's possible, but also what is in the best interest of a child and who gets to make that decision. And how do we bring in and interweave the narratives and the experience of the child and also the family in coming to decisions, which are not going to be the same in every situation just because we might be able to save a life or we have technology available. And one of the themes that so much comes through that the more we all learn and explore within the field of bioethics, the more we know that there isn't just one right answer, right? But that there's really a broad moral landscape that we can fill out and illustrate and create to consider morally permissible alternatives to choose from, and to think about with the particularity of the individual or a particular situation at stake. So Elias, that leaves me back to you because, HS has just been talking to us in some senses about microethics and about ethics at the bedside and making decisions for very tiny people, right, and their families. And the kind of work that you do really has the kind of responsibility across populations. And so I guess one of the questions I'd have for you is what stands out for you as a recurring challenge when you have to make decisions in crisis environments where you have to think about policy, regulation, and humanitarian goals, and they're oftentimes pulling in radically different directions amidst, amidst unpredictable environments and circumstances, and also usually quite significant logistical, if not flat out resource constraints. What sort of now, with almost a decade of experience after the degree, how do you approach that, and what still keeps you up at night?
Quite a few
Besides
things, I would
everything.
say. I can say that I will start from the in humanitarian world, we have some quite typical crisis dilemmas like neutrality versus human rights, for example. Okay, so you keep your stand as a neutral actor in an area of conflict, or you go out and you put on public violations of human rights. From a personal experience, I will say that violations of human rights, you don't discount, okay? So you always put in front. Can be really in the edge of a situation to prefer neutrality than, I will say, than human rights violations, especially when a lot of things in our times is in a gray zone that is not exactly, let's say, it's not fully as a violation of human rights, and is not, and neutrality is more a sense, I will say, than a fully established framework. Big discussion, I will say, that is ongoing and will continue forever. Okay, so but I can say that the training helped me a lot to go step by step in the different reasoning behind all these things. Also, the ethical reasoning help you a lot with negotiation and advocacy. Okay, so in humanitarian settings, we do a lot of negotiations. We speak with military authorities, we speak with ministries of health, we speak with donors, we speak with patients, we speak with community leaders. And all these people also have different agendas, different conflicting, many times, agendas. Okay, so having, let's say, a good, let's say, ethics training help you to improve your reasoning behind all these things. Okay, so, and to move forward also the advocacy agenda of your organization. Establish the ethical frameworks, okay, understand better things related with proportionality, for example, fairness, harm reduction, resource allocation, etc. Vulnerable groups, one of the things that we are doing in many countries is to support different groups of the society that are more vulnerable than others. Okay, so from elders, from children, and different minorities groups, etc. Impact of our decisions. Okay, so let's say it's so important, the impact of our decisions to the different groups that we support, and how we follow a specific framework in one side. For example, if you follow a complete utilitarian approaches, how minorities can go aside and can suffer from the consequences of your, let's say, utilitarian actions. Resource allocation, already we said. To reduce, you learn how to reduce moral distress in teams. I will say that this was very helpful for me. Okay, so because you learn how to, I'm more comfortable, I will say now, to facilitate discussions, to create safe spaces for people to speak, to be more attentive, I will say, in issues of moral distress in my team, etc. And of course, another issue is ethical risks in research. More and more of the organizations that we operate in different areas of the world, we are doing operational research, we are doing research in settings of limited resources. And I can say that there are a lot of issues to deal there. Okay, so issues of data privacy. Okay, so something very important. Okay, so in limited resources, and issues of, let's say, relations with the communities, issues of possible coercion, okay, so in the communities, informed consent, okay. So I still remember a few months ago in Tanzania, okay, so how we check that to be the proper language, the informed consent form in Swahili, in Tanzanian Kiswahili, not Kenyan Kiswahili, okay, so let's say, and also in English, so to be able drug users to understand, okay, so let's say the research and to participate properly, etc. Issues of in research, issues of fair treatment. When when we work with, let's say, with interventions that improve the life of one group of patients when we move to the other group of the patients. Okay, so let's say that they don't receive the new approach, they still receive methadone. Okay, so in the comparison groups that we have. So I will say that as more and more the humanitarian organizations, they are interested more and more in research, I will say that research ethics are coming strongly in the, let's say, in the decision making that, let's say, we have to take in different settings. And I can say also that someone could think that research ethics committees in different countries, especially in African countries or ASEAN, are, let's say, more, let's say, it's easier to, let's say, to bypass, etc. My experience is not. I would say Tanzanian ethics committee is one of the strongest that I have seen in my life. Okay, so, and I can say that was really challenging for us, okay, so to have a, let's say, approval from WHO Ethics Committee, from Australian, okay, so National Ethics Committee, and to struggle with Tanzanian Ethics Committee. And you have to deal also with cultural issues. You have to deal with issues that, why you put a male, female, other, okay, so you have to put two sexes. Okay, so let's say there is no discussion about that. So you have to deal with different issues that push you in your limits, okay, so of let's say, of your way of moving things.
Okay, I'm going to stop you there because I had to take notes because there are so many things that I want to highlight for those who have joined us from that. So, for those who have joined us and are listening, you've gotten a great crash course in some of the highlights of research ethics, clinical ethics, and foundational bioethics. But some of the really important points that you brought up about how do we always remember to see human rights as fundamental and inviolable in situations where we often have to make decisions that ask us to do the most good that we can in the setting that we're in, but that those kinds of decisions, when we look towards outcomes on population or large scale levels, that we don't forget the needs of those who are marginalized or excluded or vulnerable. And how do we attend to the concerns of all persons when we have to prioritize some over others? And then beyond just the reasoning through it, naming the issues, analyzing them, this really important set of skills, this really broad toolkit that you've built now on the foundation of your public health and bioethics education around mediating moral distress and helping teams manage it, negotiation skills, appreciating the influence of culture and local custom while also thinking about best practices and human rights amidst different systems, when there's military and security concerns, where there's public health concerns, and then where there's also a need and a desire to expand knowledge through research. How do we both design those questions? How do we adapt them for the circumstances? And how do we make sure that those who participate in research are treated fairly and have access to what they need as well? So really, really amazing set of issues you've brought forward. So I want to make sure that we have time after we finish for Jesse to go through some of the details of the program and the application process. So we're going to go to one little lightning round where each of you can answer a question. And if you wanted, so if there's something you wish you knew before you started the program that you'd want applicants to know now, or something you didn't expect that you ultimately gained that you want to share with those who are listening with us here, what would you like to tell prospective applicants to the program before we move on and then take their questions? Either of you could go first, or you could change the question because sometimes we do that too. Any advice or looking back, things that stand out that you didn't expect?
Please, HS, go ahead.
Ladies first, right? I think something that which is unexpected that, new applicants, it would be good to share with them. Okay. I did, I didn't expect that, that it would be kind of the support that I'm going to be receiving post-program. I felt that was the most fortunate part of like joining the program in the first place. It's not just like that 1 year, but you are going to make friends. You have friends that will be, going towards their dreams and aspiration, and actually make a difference in societies and communities. And you are in that community, and you are in with your with Dr. Becker here, and also, many others of our mentors will be always there. And it was something that it never crosses my mind that, it would be kind of a lifelong kind of a friendship there as well. So I think that is something that I think if I were to know, I would just like, do it again, that was just a question about whether I would do it again. Yeah, that was the first thing. And I think the second part is also much more of how I've grown in terms of other aspects, not just, bioethics, but also to actually knowing that I could, kind of finish the essays and, write something that, you have not been doing regularly, because, clinicians are much more, not much of essay writers and whatnot. So I think that the skills that we obtain during the program is something that I think is the most useful when it comes to expressing your thoughts about certain issues. You're writing articles, you're writing op-eds, and trying to write up a policy. And I think those were the additional skills that we find that would be the most important when it comes to doing the work that we are doing. So I would just say, if you feel there is a need, then that you have go to actually meet in terms of trying to learn more about bioethics, or trying to make changes in healthcare or medicine. I think I would just say, just apply, because it's Harvard program, but then it is something that actually supports you in terms of your growth, and not just not just that you have been being the top of your game, that they're going to just take because of that, but they kind of try and grow and improve you further. So I think that is something that I would just share with the new applicants. Just go for it. Yeah.
Thank you. That's great. Okay, Elias, leave us with your final thoughts about advice you would give to somebody who's just maybe considering coming to the program.
I will say that it's an amazing program for different levels of experience. Okay, myself, I'm coming from the humanitarian world. So from my side, I will say that it was extremely useful, very valuable. Okay, so first of all, the basic bioethics principles. I didn't know this whole package of Beecham and Childress before. Okay, so let's say autonomy, beneficence, non-maleficence, justice. You cannot imagine how important is this. When you dig in each one of these areas, you understand really much better a lot of things. In my sector, in my area, I will say that justice is fundamental. Okay, so on issues of justice, we discuss again and again, and I like a lot the discussion that arriving decades now inside bioethics, how far we not move out, but we stay in the bedside medicine, that is the area of comfort of bioethics, but at the same time, we go to the communities, we speak about justice. I will say that coming from the humanitarian world, speaking about justice is a no-brainer, okay? So let's say something that you cannot survive without speaking about justice, okay? So, and the third point is that how important is what I learned about research ethics, okay? I could say I wouldn't expect that, okay? So because I consider that I have as a manager, small interaction in research projects that I have in my missions, but I can say that this was extremely useful, okay? So because there are a lot of issues, I said already, issues of informed consent, issues of data privacy, of fair distribution, on things like that. Okay, so that are really important and really important in the humanitarian sector. And when you have this capacity to understand all these things, I can tell you that after 1 year that I was in Tanzania, the research project is in much better shape, respecting the different ethical areas, okay, so let's say, and moving smoothly forward, okay, so let's say with all the challenges that we faced, okay, so we managed to have all the stakeholders in at the same line, a lot of discussions and a lot of challenges in that, okay, so, and to respect and to keep international standards, okay, so in research in poor settings. So this is amazing.
Wow. Well, I have to also say that, one of the greatest gifts of being able to have started this program and to taught both of you and hundreds of other students is how inspiring your work has been, and seeing the ways, very different ways in which you've taken this work to really change the world for countless people. And it's just so amazing to hear your stories, to see how far you've come, and to be able to consider you colleagues and friends for life. So thank you so much for joining us.